Muscular system audio lectures. So part 3, we're going to look at some movement terminology, and then for part 4, we're going to move on to our physiology for the muscular system. So we've already talked about a little bit about some of these terms, but I just want to cover them a little more clearly and just give you some better examples to make them easier to understand. And then we want to just find a couple other ways we can kind of classify muscles too. So the first thing we want to look at is, again, we can classify muscles in a couple different ways, and one of the main ways that we're going to do this is we're going to classify them into these 3 functional groups. And you guys have probably heard these terms before, especially if you do a little bit of weightlifting or training or anything like that. But we're going to classify them into prime movers. You'll also hear the prime movers are going to be called agonists. You're going to hear another functional group be the antagonists, and then the third one is going to be our synergists. And the important thing to remember is that all muscles in the body are going to do all of these jobs at one time or another. So at some point your deltoids are going to be the prime movers, sometimes they're going to be the antagonists, sometimes they're going to be the synergists, and again it's going to change based on what action your body is sort of performing at that time. Okay, so it's not like your chest or your pectoral muscles are always going to be prime movers. Sometimes again they're going to be antagonists and they're going to be synergists depending on what you're asking them to do. So here's the primary definition for each of these. So the prime mover or the agonist is the muscle that has the major responsibility for producing a certain movement. And again, when you're naming muscles, you always have to specify, what movement and what joint you're sort of talking about. So if I say, hey, I'm going to do shoulder flexion, or if we switch and we say, okay, I want to do, I want to bend my elbow. Okay, so if we want to do sort of elbow flexion, the prime mover for that one, the prime mover for this elbow flexion is going to be my bicep muscle. Okay, but you always have to specify, because again the bicep is going to play different roles, and it's going to do flexion of the elbow, it's going to do flexion of my shoulder, it can do some rotation, it can do some different things for me. And again, you have to be really, really specific just for specifying, okay, it's the prime mover for this specific motion. Okay, but prime mover, muscle that has the major responsibility for producing a specific movement. The antagonist is going to be the opposing muscle, so it's going to be the one that opposes the prime mover, or it's going to perform the reversed action. So if you think about the bicep again and you think about bending your elbow, you want to think about, okay, what muscle does the opposite of that? And for that, it's going to be the tricep, and your tricep is going to be the muscle that extends your elbow. So it's going to be, again, the opposing muscle. It's usually going to be sort of located on the opposite side of the joint. So if you think about your elbow again, you think about your bicep, and you think about, okay, what's on the opposite side of my arm? It's going to be the tricep. And then this is an important part too, is that this antagonist, when that prime mover is working, it's going to be inactive, so your body's going to actually turn it off so that it doesn't interfere or make the prime mover's job harder. And it's going to be stretched when the prime mover is active too. So again, if you think about the bicep muscle and you think about bending that elbow, and if everybody right now, if you put your hand on your tricep and you hold your arm out straight and then you bend your elbow, you're going to feel that tricep muscle on the back part of your arm lengthen as I contract that bicep, okay? But it's not active. It's totally shut off. It's not interfering with the bicep. It's just being passively stretched as I'm moving that prime mover. And then when I straighten my arm, okay, which is going to be, I'm going to use my tricep to sort of extend my elbow or to straighten my arm out. I'm going to feel the tricep muscle work, and I'm going to feel that bicep shut off and just passively kind of stretch. So again, it's going to perform the reversed action, okay? It's going to be inactive or stretched when the prime mover is active, and then it's also going to be usually going to be located on that opposite side of the body. So a good example of this one is if you want to move down to the lower extremity, is if you want to think about your quadriceps and your hamstrings. Okay, so if I'm straightening my knee or if I'm extending my knee, that's going to be the job of my quadriceps, so they're going to be the prime mover, and the hamstrings would be the antagonist. And if I'm bending my knee, my hamstrings are going to be the prime mover, and my quadriceps are going to be my antagonist. Okay, so always good to have an example, because then I can kind of take that example and I can use it to sort of figure out any other question that might come my way. The synergist is going to be the helper. Okay, so it's going to be the one that assists the prime mover. It can do this in a couple ways. It can do it by adding force. A lot of times we'll use other muscles to kind of help and sort of use more force to get these jobs done. But it can also do something else that's really, really important too. So it can also reduce unnecessary or undesirable movement, and in that way it's going to help to provide a little bit of stability. So a lot of times, especially when you're finding your quadriceps and your hamstring and you're finding these big, huge, powerful muscles, we don't want any extra movement in our joints. We want them to be able to kind of fire in these very specific lines and apply their force in these very specific kind of patterns. And to do that, we need to keep everything else else really stable. So a good example of this one is, when I'm firing my bicep or my tricep, I'm going to keep my shoulder really, really stable. When I'm firing my hamstrings and my quadriceps and my legs, I'm going to keep my hips really, really stable. So my glutes are going to come into play, and they're going to help me to kind of stabilize and be those synergists depending on what movement I'm trying to sort of perform. So prime mover is the one that does the main job. Antagonist is, again, the opposing muscle, and then my synergist is going to be the muscle that kind of helps me and sort of assists that prime mover. Okay, we can also name muscles in a couple other ways, and we've already started to kind of memorize some of the muscles, and we kind of realize that, okay, some of the names kind of give away the function or the location of the muscle. So the names can kind of tell you. They can be named by their location. They can be named by their shape. They can be named by the size. They can be named by the direction of the fibers, the number of origins. We've seen that a bunch of times with the bicep and the tricep. They can be named by the location of their attachments. So the name's going to tell you, the sternocleidomastoid was a good one where it kind of tells you where it attaches and where it inserts. And then they can also be named by the muscle action. So you want to just realize that, all these muscles, sometimes they get their names in different ways. So example of a good location one is that it's going to indicate the bone in which it is associated. If you look at your neck muscles and you look at the muscles right at the base of your skull, they're going to be called your occipitals, and these are the ones that they're going to insert right on that occipital line on the back of your skull. So the name is going to tell you where that location is going to be. The best one for shape is going to be the deltoid. So we all know that deltoid kind of forms that little teardrop sort of on the side of your arm, which is going to mean triangle. So it gets its name from this distinctive shape. Size, we've seen these a bunch of times too. So we can have a maximus, a minimus. If you're talking about the glute muscles, you can have a longus, a brevis. We talked about the long head, the short head. Again, it's going to basically tell you, the name is going to tell you sort of how the muscles differ from each other. Direction of the fibers, we saw these in our abdominal muscles or our core muscles, and we talked about how, we have all these core muscles that are going to run in different directions, and they're going to allow us to sort of be able to adapt to all these forces from all these different directions. So you had your rectus abdominis, you had your transverse, and then we had our oblique muscles. And again, all these fibers, the name is kind of telling you in which direction. Rectus is going to be straight up and down. Transverse is going to be more left to right or across, and then oblique is going to be on a little bit of an angle. So number of origins, so bicep, tricep, quadricep, the name tells you how many heads there are. So bicep 2 heads, tricep has 3 heads, quadricep's going to have 4 heads. Location of attachments, okay, so named based on their points of origin and insertion. And again, the sternocleidomastoid is the one where the name tells you it's going to attach on the sternum, it's going to attach on that mastoid, and it's going to attach on that kind of clavicle. So the name kind of tells you, those are the best ones because the name kind of tells you everything you need to know about the muscle. And then we have other muscles. This one's really, really common too, where the name is going to include sort of the function of the muscle. So it's going to be based on the movement that the muscle produces. So some muscles are going to be called flexors, some are going to be called extensors. We had all those muscles on the inside part of our thigh that are going to be called adductors. And again, these are really, really great too because again, the name is going to tell you sort of what the function or the action of that muscle is going to kind of be. Okay, so muscle action generalities, we mentioned this a little bit too, and we said that we want to, group muscles based on their location and sort of know that, okay, if it's on this part of my body, this is what the function is going to be. And these are just some muscle action generalities where they're kind of trying to tell you, hey, if something crosses the anterior or the front side of a joint, it's usually going to produce flexion. Okay, so everything in that anterior, that front part of the shoulder, if it's on that front part of the shoulder, it's going to flex the shoulder. And this, again, helps me, it keeps me from having to memorize all these different functions of the muscles. So anything that crosses the posterior side of a joint, and again, it can be shoulder, it can be hip, it can be all these different parts, it's usually going to produce extension of that joint. Okay, so everything on the back part of my shoulder is going to extend my shoulder. And then if I get something that crosses the lateral side of my joint, it's going to produce abduction, or it's going to move me away from midline. If it crosses the medial side of a joint, it's going to produce adduction. And again, the hip is a great one for this because everything on that lateral part of my hip is going to move my leg away from midline. Everything on that inside, or those adductors or those groin muscles, are going to pull me back towards midline and produce this adduction. Okay, so use these because, again, especially when they show up on your test and you're like, oh man, I didn't memorize that specific muscle, you can use these generalities. You'd be amazed at how many times they'll allow you to kind of get the right answers. So here's a list of all the other joint motion terms, and a lot of these we've kind of covered, and then we're going to look at specific joints and just some specific things that kind of give people trouble sometimes. So we have flexion extension. We have, which is again that, am I increasing or decreasing the range between the two bones? We have abduction, adduction, which again, am I moving towards or away from midline? Horizontal abduction, we're going to talk about in a second because that again is the one that kind of gives people a little bit of trouble. External, internal rotation, so I'm rotating towards midline, I'm rotating away from midline. We talked about protraction, retraction, especially in the scapula, where I'm moving towards the spine, away from the spine. We're going to see a picture of this one. Dorsiflexion, plantar flexion, we talked about the ankle. So I was bringing my toes towards my shin, or I'm pointing my toes away from my shin. Supination, pronation comes up a few times, where most times you're talking about the forearm, but you can also hear these terms kind of in the ankle. So we're going to look at those ones, and then we're going to talk about inversion and eversion. Okay, and these ones come up again in those ankle sprains. But usually with all these terms, there's one part of the body that you really need to kind of pay attention to kind of get it right, and that's kind of what we're going to kind of look at now. And it's always good to kind of look at the shoulder and the hip, because again, they're going to do almost all of these motions, and they make it where, if I know the shoulder and I understand why each motion is named for the way it is, I can apply that to all the other joints in the body too. Okay, so here is my shoulder, and again, the best thing to do with this one is to kind of stand up and sort of just go through the motions and say, okay, I'm going to move my arm into flexion, I'm going to move my shoulder into extension, I'm going to abduct, I'm going to adduct, I'm going to internally rotate, I'm going to externally rotate, and then the tricky ones are again that horizontal adduction and the horizontal abduction. So if you're standing up and your arm is at your side and I just raise my arm in front of me, that's going to be shoulder flexion. Okay, if I bring my arm behind me, directly behind me, that's going to be extension. So if I bring my arm back down to my side and then I raise it up to the side, okay, so just as she's doing, she's just lifting it up laterally to the side, that's going to be abduction. And then when I lower it back down, as in this one over here, that's going to be adduction. The way we always remember this one with abduction is you can think about, if you watch a lot of movies where there's kidnappings or someone kidnaps a child or they abduct them and they take them away from their parents. This again always helped us to kind of remember that you're bringing that arm away from midline. Internal, external rotation is always good when you're standing. Again, your arm is at your side. You're going to bend it to 90 degrees so that your hand is pointing in front of you. And then I'm going to bring that hand and I'm going to bring it towards my stomach. That's going to be my internal rotation of the shoulder. And if I bring my palm away, or I rotate that hand away from midline, that's going to be external rotation of that shoulder joint. Okay, these are the ones again that give people a little bit of trouble. And what you want to do for the horizontal adduction and adduction, it's still, my moving towards midline or away from midline. But what I do first, as you can see in this picture, is that I'm going to raise my arm up in front of me to 90 degrees, and I'm going to raise it into flexion. Okay, so first I bring the arm into flexion, and then at that point, I'm going to move it away from me to the side, and I'm going to end up with my arm directly out to the side. But again, I didn't raise it from the side of my leg. I raised it up into flexion, and then I moved it out to the side. So that's going to be horizontal abduction. And then when I bring the arm back towards midline, or I bring it across my body, that's going to be horizontal adduction. So again, what you want to do is just stand up, and you just want to really, really quickly sort of go through all these motions. Raise your arm up in flexion, raise it into extension, abduction, adduction, and then do the rotations. And then again, do the horizontal ones where I bring it up into flexion, and then I move it away from me, or I move it across my body, and then that'll give you the trickier ones. And then you can do the same thing with the hip. Okay, but now we're going to look at scapular protraction and retraction. So again, we talked about these ones, and we said, when I squeeze my shoulder blades back together, I bring in this picture, you can see where he's brought his shoulders as far back as possible, and you can almost feel those scapula getting really close to your spine. Okay, that's going to be retraction. And then when I do the opposite and I bring my shoulders way forward, as in this picture here, I'm going to move that medial border of the scapula away from my spine, and I'm going to roll my shoulders forward, and that's going to be protraction. Okay, so towards the spine, away from the spine. So here is supination, and again, pronation. And we're going to have, again, palm up is going to be supination. Palm down is going to be pronation. And we always remember this one as in, supination's got up in it, so the palm is going to be up, okay? So supination, pronation, again, usually dealing with the forearm. You will hear these terms kind of when you talk about the ankle sometimes too, and the foot, but most times they're going to be pertaining to that forearm position. So supination, palm up. Pronation is going to be palm down. Now here are the hip movements, and again, these are exactly the same as my shoulder movements, but again, they kind of give people a little bit of trouble, okay? And you want to just go through the basic ones first, which is going to be the flexion, extension, abduction, adduction. So again, if I'm standing and I just raise my leg in front of me, that's going to be flexion of my hip, okay? If I bring my leg behind me, and you can see in the picture they're kind of showing you the arrow here where they're bringing the leg back to here, or if they bring their leg behind them, okay? So you bring your foot behind you, that's going to be extension. If I'm standing with my legs together and I lift my leg out to the side, that's going to be abduction, because again, I've taken it away from midline. And then when I lower my leg back down and my legs are back to being side to side, that's going to be adduction. Okay, so very similar to raising my arm up, raising my arm down, bringing my arm in front of me, or bringing my arm behind me. And then these ones are where it gets a little bit tricky. So you can see with this person where they're sitting on the table and they have their leg just kind of hanging straight. And then the tricky part about this one is it's not about the foot, okay? So the rotations of the hip, it's all paying attention to the knee. So what happens with this one is as you pull the foot out to the side, and a lot of people start to think, okay, that's got to be external rotation, but it's actually internal rotation. So with this one, when I bring my foot out to the side, and you guys can do this when you're sitting in a chair, and you can just swing your foot out just directly to the side, you're going to feel your knee is going to point towards your midline, okay? And that's why it's called medial rotation, is that it's all based on what is my knee doing. Is my knee pointing inward or is it pointing outward? And I can see in this picture where they swing the foot in towards midline. So the foot goes towards midline, but the knee goes outward. And that's why this one is going to be termed external rotation. Okay, so this one is one of those ones that it can be a little tricky because it's hard to remember, am I supposed to be concentrating on the knee or am I supposed to be concentrating on the foot? With this one, you have to concentrate on what your knee is doing, okay? So that can be a tricky one. Horizontal movements are the same as with the shoulder, and you can see in this one they're kind of doing both. When I want to do hip horizontal abduction, or I want to do hip horizontal adduction, what I do is, again, I'm standing, I bring my foot or my hip up into flexion, okay, so I hold my foot out in front of me, and then I can swing it out to the side, or I can swing it back towards the midline, and that's going to be that horizontal abduction and adduction, which again, you're working on that horizontal or that transverse plane. Okay, so this one again, you want to stand up, raise your knee up in front of you into flexion, bring your leg behind you into extension, do your rotations, do your abduction, adduction, and then again for these ones, you're going to bring your knee up in front of you, and then I'm going to move my leg out laterally to the side for the horizontal adduction, or abduction, I'm sorry, and then I want to bring it back towards midline, and that's going to be my horizontal adduction. Okay, so inversion, eversion, these ones are, again, you got to just pay attention to what you're supposed to be monitoring, but it's all based on the sole of your foot or the bottom part of your foot. So if I point that sole towards my midline, it's going to be inversion, and if I point the bottom of my foot laterally or to the outside, it's going to be eversion. And these ones are usually not too tricky because, again, it's more, a lot of people have sprained their ankles, and we know that usually we're going to roll that ankle to the outside, and it's going to be that inversion sprain. And again, it's termed that inversion sprain because that bottom or that sole of the foot has pointed inward when the ankle moves like that. Okay, so those are all the main ones that you need to kind of pay attention to. The next part of the muscle chapters that we're going to do are going to be more of the physiology stuff, and then we'll be ready for our next exam.